When people hear the words sex addiction, most don't take it seriously. They laugh, mock it, or label it as an excuse for bad behavior. But for the people living with it, sex addiction, or what's clinically called hypersexuality or compulsive sexual behavior, isn't a joke. It's real, it's overwhelming, and it can destroy relationships, careers, and self-worth. Let's talk about what sex addiction actually is, and why it's time we start treating it like the serious mental health condition it is. What is sex addiction? Sex addiction, also known as hypersexuality or compulsive sexual behavior, is a condition where a person feels unable to control their sexual urges, thoughts, or behaviors, despite the negative consequences. This is not about having a high sex drive. It's about compulsive behavior that feels out of control. People with this condition may spend excessive time thinking about sex, engage in risky or impulsive sexual behavior, use sex as a way to escape stress or emotional pain, feel guilty, ashamed, or distressed after sexual activity, and try to stop but feel unable to do so. It becomes an addiction when it interferes with daily life, responsibilities, and relationships. So what are the signs that someone has sex addiction? The most common signs of compulsive sex addiction include the following: recurrent and intense sexual thoughts that dominate the mind, excessive consumption of pornography, engaging in sex with multiple partners without concern for consequences, using sex to cope with anxiety, boredom, depression, or trauma, failed attempts to reduce or stop the behavior, lying or hiding behaviors from loved ones, feeling regret, guilt, or emotional pain after sex, and risking personal safety, finances, or health to fulfill urges. It's not about pleasure, it's about compulsion. And like any addiction, the behavior becomes more about escaping than enjoying. Let's now discuss the cause of sex addiction. The causes of sex addiction or compulsive sexual behavior are, honestly, complex and not fully understood. But they can include things like brain chemistry imbalances involving dopamine and serotonin, co-occurring mental health conditions like depression, bipolar disorder, or anxiety, and past trauma, especially sexual abuse or neglect. Substance use disorders, which may co-occur or fuel the behavior, are also a factor, as well as environmental or behavioral factors, such as early exposure to pornography. Genetics, too, may make someone more prone to compulsive behavior. Ultimately, it's not just a matter of willpower. It's often rooted in deeper psychological or neurochemical issues. Why is sex addiction so misunderstood? Sex addiction is, honestly, one of the most stigmatized mental health topics out there. Here's why it's so misunderstood. Society often glorifies or shames sex, but rarely discusses it with balance. People think, you can't be addicted to something that's natural. Many confuse it with moral failure, not a mental health struggle. And, it's often used as an excuse in the media, which really hurts genuine sufferers. But compulsive sexual behavior is not about enjoying sex too much. It's about losing control and suffering because of it. The pain is real, the isolation is real. And the shame? That's often the hardest part. So, let's talk about how sex addiction can really affect someone's life. When left unchecked, sex addiction can spiral and, honestly, devastate every area of life. Relationships often break down because of secrecy, betrayal, or infidelity. Mental health really suffers too, with depression or even suicidal thoughts becoming all too common. Self-esteem can just collapse as the person might feel, broken or even disgusting. Legal trouble can also arise from inappropriate or risky behavior. Work performance drops, sometimes leading to job loss, and finances may be drained from subscriptions, sex work, or risky spending. It creates a cycle. Shame leads to acting out, which leads to more shame. And many people feel completely alone inside that loop. How do you know it's a disorder? Well, there's actually no official sex addiction diagnosis in the DSM-5, which is the main manual for mental disorders. However, compulsive sexual behavior disorder is recognized by the World Health Organization in the ICD-11. Diagnosis usually involves a mental health professional evaluating sexual behavior patterns, ruling out other causes like manic episodes or medication effects, assessing the level of impairment in daily life and emotional health, and checking for co-occurring disorders like depression, anxiety, or trauma. If the behavior is persistent, difficult to control, and causes distress, it's definitely time to seek help. treatment and recovery options, there is hope. Sex addiction and compulsive sexual behavior can be treated, but it takes honesty, support, and professional guidance. Some effective treatments include group therapy or 12-step programs like Sex Addicts Anonymous or Sex and Love Addicts Anonymous, medications such as antidepressants or mood stabilizers to help reduce urges, trauma-informed therapy for those with abuse or PTSD history, couples counseling to repair relationship damage, and cognitive behavioral therapy, which helps identify thought patterns that drive compulsive behavior. Recovery doesn't mean suppressing sexuality. It's really about regaining control, rebuilding trust, and rediscovering healthy intimacy. Let's be clear. Sexuality is not the enemy, but when it becomes compulsive, when it causes suffering, it's time to talk about it. You're a human being dealing with something real, and healing is absolutely possible. You deserve understanding, not judgment. Support, not shame. If this message hit home, please like the video, share it with someone who needs it, and subscribe to this channel for more mental health education videos.